Hello, my name is Shiven and I'm a current Master of Bioethics student at the University of Pennsylvania Perelman School of Medicine.
Hello, everyone. My name is Keshav Sharma, and I'm a first-year Bachelor of Health Sciences student at Queen's University.
So our research project is titled Expanding the BC Tripartite First Nation Health Plan Model to Inuit Communities, and it aims to apply this health model, or plan rather, to address health issues prevalent in the Inuit of the Nunavik region in northern Quebec. As a bit of an overview, the TFNHP was a unique collaborative health framework agreement implemented in 2007 between BC First Nation leaders, the BC government, and the Canadian government to elevate First Nations health governance in the design and delivery of health services in First Nation communities, with the governments acting as sources of funding and logistical support. The aim here is to simulate the functionality of the TFNHP in Inuit communities of Nunavik, the focus being the town of Porvinatuk, to evaluate its efficacy in addressing key health issues prevalent with the Inuit people of this region.
And so, in terms of our methodology, an Inuit plan would entail finding means for transitioning design, management, and delivery of health services to an Inuit health governance authority. Perhaps the most important challenge is finding suitable means of resource allocation, considering the remoteness of Inuit communities and maintaining effective communication between partners and stakeholders in ensuring their timely implementation of health services and programs. While the BC TFNHP provides a positive precedence to its re-implementation, we must acknowledge that circumstances regarding health in Inuit communities may be starkly different from that of BC communities. And so in the next slide, of many outcomes listed here, this project hopes to establish reasonable and respectful mechanisms to ensure complete Inuit community involvement in decision-making and implementing health programs and services to their social determinants of health, perhaps the most prominent of which is high suicide rates in men. These suicides alone account for over a third of the gap in life expectancy. And a second and also very important one is food insecurity, considering its prevalence in Inuit communities. And so the benefit of having a comprehensive health plan is shown in the table below in this slide. See, the influx of client visits indicates increased health consciousness and willingness to get treated by healthcare providers. And so the deterrent that the healthcare system once was is not what it is anymore.
Right. So the underlying message here is that the expansion of this framework is a stepping stone for what we hope will become an integral part of the entire Canadian healthcare system that is devoid of discrimination and serves the well-being of all Canadians. Thank you so much for your time.
Thank you.